has started. Here we are, the very beginning of Allied Health Week. My name is Deneen Diamond. I'm so excited to be here from the Center of Excellence for Health, and we have a very special guest to kick off our Allied Health Week this year. And we are going to be speaking to experts and professionals within Allied Health all week long. So all of the sessions are going to be at 10:30 and 1:30. They will all be recorded and posted on the Center of Excellence website. But we do love having teachers here virtually with their students. So if you are a teacher signing in, can you please put your school, the grade level, and the number of students that you have with you. If you are just a student on your own, that's absolutely fine. We love having students as well that sign in. You can just place your name or your school, your grade, and that would be lovely. So without further ado, I am going to introduce to you our very special guest today, Samantha Hachey. She is the wellness coordinator for the New Brunswick Association of Nursing Homes, and she will be exploring the role in the long-term care sector. Sam and I discussed this morning how diverse social work can be. So she's going to really dig into what that looks like and maybe some of the opportunities that are here in our province, and will be great to open the floor for questions as well. So without further ado, over to you, Sam.
Hi, everyone. I'm just going to share my screen. Can everyone see that? Yeah, okay, perfect. Thanks, Deneen. Okay, so hi everyone. My name is Samantha Hachey, and I'm the wellness coordinator at the New Brunswick Association of Nursing Homes. So I'm here today to talk about my job, and I'm going to also talk about what led me here. And as Deneen said, my job is very versatile. I do a little bit of everything. So if you have any questions throughout the way, just let me know, or I'll have my contact information at the end, so you can feel free to send me an email at any time. So before I get started, I just wanted to thank Deneen and her team at the Center of Excellence for Health for organizing all of this and for having me today. So this is a list of what I'm going to talk about today. So I'm going to talk about, I'm going to start off by talking a little bit about me and my personal skills. I'll talk about what I do for work, and then I'll talk about the organization that I work for and what we do. And then I'll talk about what education I took and what training I have in order to be able to do my job. And then I'm going to finish off talking about what my day-to-day looks like. And as I said, my job is a little all over the place. So my day-to-day really looks different every day. So a little bit about me. So I am originally from Bathurst, New Brunswick, a small city in northern New Brunswick. It's about 3 hours from Fredericton. I am bilingual, so I do speak French and English fluently, and I can write in both languages as well. And then fun fact, I actually went to French schools from kindergarten all the way up to grade 12. So in 2012, I graduated from high school and I moved to Fredericton to attend St. Thomas University. I have a Bachelor of Arts and a Bachelor of Social Work, and I'll talk a little bit more about that later on in my presentation. So currently, I live with my husband and my 2 greyhounds, Hera and Odin. So on the slide, I have a picture of Hera and Odin. So Hera is the one with the darker jacket, and with the lighter jacket, that's Odin. So they're both rescued racing greyhounds from the United States. And we adopted Hera in 2019 and Hera in 2020. And we adopted them from a rescue organization in Nova Scotia. So on my free time, I like to walk my dogs, do some arts and crafts, read and bake. I'm not very good at baking, but I do enjoy doing it. And I also didn't put this on the slide, but this past summer, my husband and I started playing golf. We're not very good at it, but we do enjoy playing it. And we also play disc golf, which we also really enjoy as well. All right, so on the slide, I listed the personal skills that I think are really important as it relates to the job that I do. So the first one that I listed is helping others, and I think that's like the most important one. So I've always been someone who likes helping others, and in my job, I'm constantly helping others. It's really what I do every day. So whether it's connecting them to the resources that they need or guiding them through difficult situations, that's mainly what I do on a day-to-day basis. So the second one that I listed is empathy. So empathy is the ability to understand and share the feelings of another. So in my job, I often have to put myself in someone else's shoes when I'm trying to help them, really trying to understand where they're coming from, and that way being able to provide them with the appropriate resources or support that they need. I also listed active listening. That's also an important one. So active listening is when you listen attentively, understand what the person is saying, you respond and reflect on what is being said, and retain that information for later. So a big part of my job, as I said, is connecting people to resources and support and to provide guidance. So when I'm doing that, it's really important to understand what the situation is so that I can provide the best support that I can for them. And then the last two skills that I listed are communication and organization. So communication is really important because it has to be effective. Because I'm constantly communicating with others throughout the day, whether it's on the phone or via email, it plays a really big role on my day-to-day work. I also listed organization because I do a lot of different things at work. As I said, my job is very versatile, so it's important for me to be organized in my paperwork and my files, in my emails, and even just to have my office well organized, just so to make sure that I stay on track and to make sure that I get my work done. So as I mentioned at the beginning of my presentation, I'm a wellness coordinator and I work at the New Brunswick Association of Nursing Homes, or for short, NBANH. So I have worked with NBANH since February of 2019, so almost 5 years. And I've really had a lot of different roles since I've gotten hired. And that's been really nice because I've gotten to test or try different things and see what I like and I don't like, and really try to, establish what my interests are. So, just a little bit about NBANH. So, NBANH is an employer association that advocates on behalf of all 73 licensed nursing homes in New Brunswick. This means that we represent all nursing homes in the province in different capacities, such as providing legal and labor relations services. We provide education opportunities, recruitment and retention support, network opportunities, and more. So as a wellness coordinator, my main focus is employee wellness. So just to make sure that the employees that are working in nursing homes are healthy, and I help management make sure that their employees are healthy, or help them support their employees. So one of the things that I do is provide nursing homes with information on anything that is wellness related. So on Monday mornings, I send each nursing home what I call a weekly wellness tip, and that includes information on physical health, mental health, nutrition, really anything that relates to wellness that could be useful to the employees working in nursing homes. And every season, so 4 times a year, I create a wellness newsletter that includes information on the employee benefits plan, some positive stories from the nursing homes, healthy recipes, and things like that. I'm also the main point of contact for our employee and family assistance program, as well as for the employee benefits plan. You may not know what those are, and that's okay because I really won't go into a whole lot of detail about that. So if the nursing homes or the management in nursing homes have questions about those things, they would come directly to me, and then I would point them in the right direction. And then a little bit unrelated to my position as a wellness coordinator, I do a lot of work with our recruitment and retention coordinator. Her name is Emma. And the main thing that I do there with her is just help her in supporting nursing homes with their recruitment and retention efforts. So we help them find people that they can hire, and we connect them to various resources. So through my recruitment and retention work, I also get to attend job fairs at universities and colleges and in schools. So in September, I got to go to Toronto to attend a job fair. That was really fun. Um, earlier in the fall, I got to go to the University of Moncton and attended their job fair. I got to go to a job fair at Barker's Point Elementary School. That was really fun as well. I got to meet all the students there. And then, my favorite part about my job is that I get to work with such positive and passionate people. My boss often says that people who work in long-term care are some of the most passionate people, and it really is so true. It's really amazing to be part of such amazing work that happens in the sector. It really is heartwarming. And I also wanted to talk about relationships. So in terms of relationships and who I work with a lot of different people. So obviously I work with the people in my office, but outside of that, I work with the management team in the nursing homes, as I mentioned. We have partnerships with a lot of different organizations, such as the Center of Excellence for Health, different government departments. There's also a lot of collaboration that happens with my coworkers at NBANH, as I mentioned. And we also do a lot of committee work. So at NBANH, we have a lot of different committees. So for example, we have a recruitment and retention working group, which is a committee. So we have different government departments that are part of that. So there's just a lot of different partnerships that happen. And then to work in a job like mine, there are a few different career paths that you can take to get here, which is kind of nice. So, as I mentioned, I went the social work path, and I'll talk more about that on the next slide. So most often people will have a law degree or a business administrating degree, an accounting degree or certificate, human resource experience or a degree, or even a nursing degree. But it's not limited to just that. There's a lot of paths that you can take in terms of education that could lead you to work here or in long-term care. Okay, so training and education. So how did I get to where I am now? So I'll start at the beginning and I'll just give you kind of a brief, just a brief description as to how I got here. So I have known that I've wanted to pursue social work since the age of 14. I had a class in high school, and I can't remember what class it was, but we had to interview someone about their career for one of our projects. And I interviewed a social worker for my project, and I was really just fascinated about the work that she did and just hearing about how much she got to help people. And since then, I've always been interested in pursuing social work. So in order to do a Bachelor of Social Work, you need to do some sort of bachelor's degree beforehand, usually a Bachelor of Arts. So after I graduated high school, I attended St. Thomas University here in Fredericton, and I completed my Bachelor of Arts in Sociology and Gerontology. So sociology is essentially the study of social problems, and gerontology is the study of aging, which is how I realized that I wanted to work in long-term care. So once I completed my Bachelor of Arts, which is a 4-year degree, I went on to complete my Bachelor of Social Work, which is a program that's around 18 months. So while I was doing my social work degree, I did a placement with NBANH, which is how I ended up getting a job here. And I really wanted to mention that connections are very important when you're looking for a job and establishing a career. So if you ever get to do job placements, all those connections you're making are very important. So I'm going to use the slide to talk about what this type of career can lead to. So as I mentioned, I have a degree in social work, and with a degree in social work, you can pursue all kinds of different careers in many different areas. So for example, social workers can work in hospitals, schools, work with the government, different community organizations, and really a lot more. You can really do almost anything with your degree in social work. It does offer a lot of opportunities, which is great. You get to try a lot of different things. So because my social work degree is so versatile, I have worked in a few different roles at NBANH, as I've mentioned earlier. I started off as a disability claims coordinator, and then I moved on to being a project coordinator, and now I'm a wellness coordinator. And I will say that the job that I have now as a wellness coordinator relates the most to social work, and I feel like this is more up my alley. So social work has opened so many doors for me and has allowed me to try a lot of different things. So in the future, my career can lead me to many different opportunities. And because social work is so versatile, it's hard for me to say where I'm going to end up in the future because you just really never know. Yeah, so this leads me to the end of my presentation. So I just wanted to say that if you're someone who enjoys helping others, and you want the opportunity to try new things, social work might be a good career for you because it does open a lot of doors. Um, and if you know what type of career you want to pursue, please don't give up on your goals. There's going to be a lot of times when it's hard, but please never stop crying or never stop trying. It's going to be worth it in the end. Yeah, so I'll take any questions if there are any. My email is there. Feel free to email me at any point if you have any questions.
Awesome. Thank you so much, Sam. That was so lovely and amazing how many opportunities and how many jobs are out there for social
Yes.
workers. And it
Mhm.
was so lovely to hear you say that you interviewed somebody when you were 14, because on the call right now, we have North and South Esk Regional from
Okay.
ASD North. And there's 25 students in grade 7. So I don't know, Miss Matchett, if you want to put your camera on and wave to us, but we would love to open up the floor for questions. If any of your students have questions, they certainly can ask in the mic or put the camera on, or you can type as well. But yeah, neat to see that you actually probably was it personal wellness or PDCP?
I have no idea. So I went to French schools and personal wellness, it wasn't called that. I can't remember what it was called. But I remember when I was interviewing her, I had my eye set on social work, but more in terms of like criminology.
Okay.
And as I got into my gerontology major in university, that's when I realized that no long-term care was what I wanted to do.
Neat. So
Yeah.
neat. All right. Miss Matchett's just saying they don't have a camera or speaker, which is unfortunate. If there's any questions that your students have for Sam, Miss Matchett, you certainly can type them. And also, Sam put up her email address, and we can put that in the chat. I'll just get my V to put that in the chat as well. And we can just have that there for future. The kids really enjoyed this session. We are working on exposing our students to new career opportunities through global citizenship. And this
Oh,
was really
nice.
helpful. Awesome. And Miss
Awesome.
Matchett, we're having sessions all week long. So hopefully I'll see you and your students every day. And maybe we can get a camera that works at some point. So we're very, very thankful that you're here. And Sam, I have a question for you.
Yeah.
One of my questions when I was listening to you was I'm sure that you've been in situations that maybe you go home at the end of the day and it doesn't make you feel very good. So, what do you do as a person to really detach from some of those situations?
Self-care is really important. And when you're doing your social work degree, they really drill that into you.
Yeah.
So when I go home, the first thing I do every day is walk my dogs with my husband. So that just kind of gives me the opportunity to kind of just debrief with him about my day, and just kind of decompress. And then when I get back home from my walk, I already feel so much better. And then if that doesn't help, I just do things that I really enjoy doing. So like reading a book or arts and crafts.
Baking.
Yeah, just things like that. Yeah.
And self-care is so extremely important. That's
Yeah.
something else that's very passionate in my world. And
Yeah.
and I can imagine just as being a vice principal, a lot of that mentorship and maybe some of the sticky situations that
Hmm.
probably are that you're confronted with, you really
Yep.
do need to be able to leave that at home. So
Absolutely.
yeah. Awesome. Well, thank you so much. I have 100 questions, but we will stop the recording. And again, thank you, Miss Madgett from School Up North for being with us today. And we will hopefully see everybody at 1:30 or tomorrow. Again, these sessions will be recorded and will be posted on the website. Sam, thanks so much from the Center of Excellence for Health. You did an amazing job kicking off the week, and we really appreciate being partners with the New Brunswick Association for Nurses Home, and has been an amazing opportunity. And for teachers that are listening, if this is something that you're interested in and you really want to maybe go visit a home, please reach out to me and I can help facilitate the introductions and conversations on what that looks like, because we love offering intergenerational opportunities to students and to our seniors. And it really does provide a lot of different learning opportunities for the students and the seniors. So with that, I'm going to sign off. Thank you so, so much, Sam. You have been amazing. And everybody have a beautiful day and take some time to smile.
Thank you so much for having me. Have a good day. Bye.